Hey, what's going on? It is the Merce and Nurse Show, episode 19.
19. Hello, everybody.
But I am your host, the Merce, and then this is my co-host, the Nurse.
Wait.
What?
What? We're both the hosts.
Yes, host and co-host. It's not like one's less the other. It's just instead of saying host and host, you say host and co-host.
No, we're gonna say host and host. This is one host, the Merce, and the other Nurse.
Why? Why are we starting? Gosh, Lee.
This is
I just got off a weekend shift.
I believe
back to
in
backs and
equality.
What? Equality? I can't even talk. Equality, mother. Equality.
Oh, we're sorry. Okay,
Oh,
funny
man.
story. Noah
What?
just got off of 36 hours, and me and my husband said, well, you know what? Let's go get a pizza. So I always order Domino's online. I have the app. And so my husband does. Well, I guess I got him shooken up because I wanted some cinnamon twists, which they're good. Shout out in case Domino's wants to send some to me. Anyways, we get home. We're starving. We just got pepperoni pizza. Ed opened the box and I'm like, where the pepperonis at? He said, oh, I think I forgot to place a topping order. So we had cheese pizza. So I just thought that was funny.
But I mean, you
still
can't
good.
really say that because there's a lot of people that just eat cheese pizza.
Yeah, I know, but I didn't want to eat cheese pizza tonight. I wanted pepperoni pizza tonight.
We have ham in the fridge. Could put ham on it.
You even put lunch meat ham. I could put on lunch meat ham.
Wow, you know, people who are hungry wouldn't appreciate that.
I am not knocking anyone's
Yeah,
situation.
okay.
I just thought that was funny.
And for those out there who are lactose intolerant, like, just be happy you can have at least cheese on your pizza,
You know what? You're right. Because if not, I'd just be eating bread.
and that's not gonna help. You know, being
Okay.
diabetic.
Well, anyways, I just thought that was funny. Hey, don't say my business out there. Don't say my business out there.
Oh man,
That's my business. Okay.
Let's see. So
Anyways.
what's new? What's new? How's the jail been? Anything crazy? Anything interesting?
Of course, it's always crazy.
I heard you wanted to quit this past week.
I did.
Yeah, that's what Dad was like.
Oh,
Yeah,
I
you're
would
like,
say
I'm
that.
done. I'm done with this place.
I
can't
always
deal with
say
them.
that. I always say that. And then my husband said, even if you work, because even if you work like at a coffee house or Buc-ee's, he said, you still complain. No.
She wants to quit, guys.
No, it's just busy. I can say my days go by
stay?
fast.
Because I know you. Hours are still a little weird right now because you're still, I guess, on orientation phase.
Oh,
but-
but I do the Monday through Friday.
Yeah. So, but why are you staying so late though?
It is so busy,
I
especially.
thought you were for 5.
Yeah. Well, especially like on Fridays, we have like the doctor, we have the psychiatrist, and then we have a mental health counselor, social worker, and it's busy. It is just so busy on Fridays, but it's just one of those jobs, just like nursing. Like you could probably stay 24 hours and just keep working. Like what I'm saying is like, there's never going to be a stopping point for you. You just got to leave. Yeah.
But I'm like I know for me, like right now, like I stayed back a little bit because I helped the oncoming.
Yeah.
Because today was weird. Like I don't know what's about y'all. I guess y'all don't want to
Like, what do you mean weird?
go to the ER on Father's Day. Well, today's Father's Day.
Yeah. Happy Father's Day
to all you
to all
guys
the dads out there.
You will see this tomorrow, but happy belated or early. I don't know how you say it. Whatever. Anywho, so but yeah, nobody wanted to come. Like the whole morning, we just got slammed. We're fighting people screaming, running around. I had one guy, like I'm talking to him. He's like, yeah. No, I know what you mean. I'm like, brother, who are you talking to right there? I got another one that's like, she's like, I'm done. I want to end my life. But she was voluntary hold.
Yeah.
So that was pretty cool. But anyways, yeah, I'm just like, what is going on? And then it come around 1 o'clock, 2 o'clock. It's like, where's everybody at?
Because everybody's barbecuing.
That's
Everyone's
what
at
I'm
the
saying,
river.
dude.
Everybody's.
We had one patient for at least an hour until finally they came back. And it's really like towards the end of the shift, and I'm sitting there because I have no patience right now. Like my charge was like, Noah, you can go home. And I'm like,
hey,
I need my hours.
Hey, that's when you should put a Facebook thing. ER is empty. Perfect time to come. You should be like one of those people that be like, we have no traffic right now.
But it was so low. Like the census was close to nothing that my charge was like, hey, if you want to go, you can go now.
Yeah.
And I'm like, I said, I need my hours.
Yeah. They
Like, I
must.
need some money.
That goes to show you everybody probably was barbecuing.
But tomorrow, though,
Nat,
dude, tonight to tomorrow,
a lot of call-ins tomorrow.
everybody's gonna be coming in like, I'm sick.
Dads
My tummy hurts.
dads are drunk calling in.
Oh my gosh, dude! Like, I can't tell you how many times that we have people like leave without being seen.
Yeah.
Because they couldn't wait. And like in my head, I'm like,
Yeah.
well, it probably wasn't that serious
And
if you had to leave.
I always stick up for anyone, especially Ari, since I live here, our emergency room, because it's like I always stick up for them because the normal person, like let's say you go in or someone, taking grandma, right away they're mad, but they don't know behind the scenes that Noah said the other day, y'all were to capacity.
No, it was so bad. Like I said, that we were in that version.
Yeah, that's what I'm saying. So diverging, people don't know. Y'all are sending people to New Braunfels or
well. So I found out this. So for us, I believe our policy. Don't quote me, but for us to be on diversion, we have to have 2 ICU patients that need to be admitted, and then 4 regular floor patients need to get admitted. What I say by that, I mean there's 2 ICU qualified critical patients. With another 4 patients that need to go to the hospital. If you gotta get admitted, you need some constant nursing, skilled nursing, right?
Okay.
And so, unlike in the ER, when you have these amount of patients, you become that floor nurse to that patient.
Yeah.
You're giving them their meds. You're doing all your I's and O's. I mean, you're doing. People get mad at ER because they're like, oh, well, you didn't do the med rec, or you didn't do this scheduled meds, or how much did they pee out? Because you bam, 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 you're hitting people left and right. Discharge, you go.
Because that's more for when they're like admitted to a med
when they go to a floor, that floor nurse take
Got
everything, and you start, now it's a part of your workday, right?
Yeah.
Well, when you have that many patients in the ER that need to go somewhere, but they don't have a bed yet, at that point, you must go on diversion because those nurses can't do what they need to do because they're giving all their effort to 1 or 2 patients, especially if they're ICU qualified. You got to do like that, 1-on-1, 2-on-1. So, but no, they were on that version. It was like, dude, it was stupid. And then here we are today. Like, I had 1 patient for the last 3 hours. I'm like, I was so bored. I'm like, I saw someone that just came in and got registered. I'm like, hey, come on, I'll take you back. Let's go.
And they're the ones that you're like, do you mind putting a review on Yelp? I give the ER 5 stars today. I was treated like a king. No, but so anyways,
it was crazy,
I always
though.
stick up. Since you said that, and I'm sure there's just people that get mad, but they don't realize.
Well, I guess what that came from was because we're talking about like. Anyways, I stayed after, but because I was finishing my assessment.
Yeah.
Like, because I was kind of bored, so I got that patient back.
Yeah.
And the night shift nurse got there. And I gave him a report.
Yeah.
He's like, "Hey man, you're good to go." I said, "No man, let me finish this because I assessed her. I did all my stuff, so let me just put my notes in." He's like, "You sure?" I'm like, "Yeah, I got it." So I just did it. So so I guess sometimes if it's that new oncoming one, you can be nice and lend a hand, because I know you said you've helped before pass meds for the evening.
And I also sometimes I can set up for the next day, and it just makes it so simple for easier. But
I got you.
and also those paychecks are nice too. You're like, huh? Hey, even though you're exhausted.
Dude, do you see how much the government takes?
Yes.
Oh my
I know.
God. I'm like, you're taking it, but I'm the poor one. I need that.
I know, and I just told Dad earlier. I said, well, I would have. It would have been a really good check, but yeah, they took like $700 out of the check.
Yeah, you know what's insane is like, I forget who I was talking to, one of the nurses, but they're like, once you hit so many hours, it's almost not even worth it.
Yeah,
because it just goes straight to taxes.
I know, and
That's
I'm
so
like,
weird.
I'm never gonna get food stamps the way I'm going. And I'm hungry.
Damn it.
I need some food in my house.
Oh man.
But anyway,
dude, so we had a patient. This dude, he got electrocuted.
Ooh.
Well, I was in triage helping. And
like, was he an electrician, or he was just doing something around his house?
He was working around his house, I guess.
Oh God.
But yeah, he was working around his house, and I saw him out in the because I heard, because where triage is at right next to reception.
Yeah.
And so they came in, and I just heard I got electrocuted. I'm like, okay, well, he's sitting down. We'll triage somebody else. I go out there to take somebody back to the room, and all of a sudden I hear, man, why the heck? I'm like, I need help over here. I guess it was the wife or the girlfriend.
Oh,
Somebody,
of the guy,
yeah.
of the person that was
Yeah.
there.
And so I look and I see like he has his arm wrapped in like those. You know how Dad has like the cloths to clean the car.
Oh yeah,
Yeah, like wrapped
He had to,
around. Yeah, and I'm like, and it's a little red, and I'm like, I go back inside. I'm like, hey Tessa, I said, hey, I'll be right back. My nurse I was working with got some gloves, and I just got some gauze and just a bandage, because I know it's probably dirty. At least I can put some clean gauze for the meantime till we get back there.
Yeah.
Dude, so I went out there and I looked at him. I said, "Hey, bro." I said, "Hey, what's going on?" He goes, "The wife, significant other was like, hey, he got electrocuted. Like, he couldn't talk. He was just like out of it." And I'm like,
And she drove him there.
"Yeah." And so I'm like, "Let me see." And so I grabbed it and undid. I said, "I know it's gonna hurt because
Yeah. Oh, it was the fibers all stuck and stuff. How did it look?
I pulled it off.
Oh God! Don't tell me you pulled all his skin off.
Mom, it was this big, about 4 inches, 4 by 3 inches. It was gone. It was just muscle sitting there, muscle and tendons.
What? All
like
his
he,
skin?
like his hand was moving, and you can see the muscle contracting. And I'm like, I pulled it up. I'm like, oh, I put it back on,
my
and I put more gauze. And I held it. I'm like,
Was it bleeding?
it
Or
was.
was
It was. There was no arterial bleeding. That's what I was
now,
afraid
I'm
of.
not trying to be funny, but it was probably cauterized, right? By the time we get electrocuted.
Well, I'll get there. Okay, so
Can you imagine the pain? He was probably in shock.
no, yes. So I said, hold on.
Were you like, we're gonna have to put him on the list from 10 to 2 for
No,
one?
I know. I sat there. I said,
my God.
I ran it back into the room. I said, Tessa, we have a 1 now.
Yeah.
And she goes, what? And so I said, I brought him back there, and she went out. Well,
Yeah.
I told her, she ran out with me. We look, and she goes, don't even move. Hold pressure the whole time. And so she immediately called the charge.
Yeah.
So hey, I need a trauma 1 now. And so we went straight back to the trauma bay. And everybody rushed in, like looking.
Like when you say trauma bay, what is it? Is it a certain room?
There's 3 rooms. It's
Okay.
room 1, 2, and 3.
Okay.
They're just really big.
Are they for people like maybe like a bad car accident or something like that? Okay.
Each room has their own crash cart.
Oh, okay.
Has the PEDS cart. Has all the stuff to
Okay.
like bedside, like thoracentesis.
So whatever
chest
you
tubes.
need.
Yeah.
Okay.
Yeah. So I call them trauma bays. They're just
Now, was he in a wheelchair? Y'all making this guy walk? Please tell me.
Well, no, he was alert. He was like,
Yeah.
let's go. So he was
Okay,
walking with us.
okay.
But so we got him in bed, and like the doc got there, and they're looking, and I just saw they were like that.
Oh my God.
Cat down the holy crap.
Because I mean, it's not like you can just
no, so
pack
like,
it, clean it. I mean,
no, so like well, I was in triage, so I didn't stay. I just dropped the patient off because
Yeah.
we had more people.
yeah,
And so I'm coming in like 30 minutes later, I come back, and they did a full workup, lines, everything.
Yeah.
And so what happened was the story was he was working on his AC conditioner, the big
Oh
thing.
my God.
Well, when he was in there, he touched something
Oh my
which
God.
shocked him, and he was holding for a second.
Oh, yeah.
And when you're shocking, you're trying to let go.
But
Well,
yeah.
he put all his force in letting it go, and when he finally let go, the blade sliced it all off.
Oh, so it
So
was okay.
It wasn't cauterized. It's the shock of him trying to. And but yeah. So we're like, what the heck? And so they're
my
but
God.
it was so bad that
Oh
he
my
needed he needed a trauma surgeon. So
Yes.
we had to transport him out to San Antonio. Like it was like
Oh my God, that is
within 30 minutes, it
crazy.
was like bam, 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 and he's gone. Because like I said, we can't. do
Yeah, of
nothing.
course. And so
But, I
did
mean,
he
we
go by
s-
ambulance or? how
Oh
did-
yeah. No, it was.
Oh God.
But yeah, and I just remember.
But
just,
that's not what you thought you were gonna see.
no, because like he's
Yeah.
like, oh, what the note was like, hey, he got electrocuted. So I'm thinking, cardiac something
Yeah.
or some electrical burns.
Yeah, that's what I was
And
thinking.
so
like the electrical burn.
when I saw that thing, I'm like,
Oh
but I was
my
like,
God.
why is there blood?
Yeah.
And so when I lifted, I was like, that's a hole. I
Oh
said, it's
my
not a
God.
cut. It's a
I
hole.
bet- well, you are in the. I'm sure.
No,
oh, there
yeah,
you go.
but-
That's
but-
emergent. That's crazy.
But you know what? I really, this goes back to, remember that episode we have like the nursing intuition?
yeah, you just knew
Of
something
just
was
sitting there, of just hearing him complaining and then taking a second look at his bloody rags.
up. Yeah.
And I'm like, you know what? Just go look at it. Because if it wasn't bad.
And I'm surprised, like his girlfriend, the person who's, you think she would say he's got like, ma'am, he's got a hole. Like they
But
just.
I don't think they ever realized it because apparently
Oh,
'cause
got
he
it.
wrapped it up and it was just all in the heat of the moment.
And then he walked in. They probably thought, well,
and
he
so-
can
but
wait a little
I
bit.
mean, don't get me wrong. Like we're bringing him back
Yeah,
to
I know,
triage, but it was
but-
at that moment like, you know what? I just want to look. And
Yeah.
and so I said, something told me to just go take
Yeah.
a look and just at least put bandages
Yeah,
on it, just so
yeah.
I could get eyes on
Yeah.
it. Because if somebody's coming in with a bloody rag, you might want to just take a look at it.
Yeah. Are they holding their hand?
Because
Yeah.
I'm afraid, if it was arterial.
Of
I was afraid of
course.
that, but it wasn't. But so I just, hey, let's go back right now, guys.
You're like, let me put my poker face on until I go talk to my my nurse
No,
partner.
100%. I went back
you
to her.
like,
I went back to her. I looked at her. I'm like, we gotta go now. And I come back. I'm like, don't worry, we got you. I'm gonna keep some pressure. We're just gonna walk back there.
You're fine. You're fine.
Oh my God. She looked at me. She goes, do not let go of it. I said, I'm not.
Oh my.
But he got taken. He got taken
Good.
care of
I
it,
hope
and
he's-
because I think it was like talking to the doc. I think they said the trauma surgeon. Then they needed him to go back to do some reconstruction,
Yeah.
and then they were gonna get cosmetic to come and clean
well,
it up.
I hope he doesn't get. I hope all goes well. We don't
Oh
get
yeah, no,
infection. things like
he
that.
should be fine. Like I said, everyone caught it. They started as a prophylactic.
Yeah.
But yeah, I was
You're
pretty,
like, well, I'm not gonna put a line there. Draw blood from there, and it was your
I'm like,
other arm.
man, that's a nice AC rail. But
Oh
no.
my god.
Yeah, that was wild.
I bet
That
that
was
was
wild.
crazy. That's crazy.
So I want to talk about something a little deep,
okay.
just because today's a very, very special. And you know what's crazy? Like when I typed this out,
Yeah.
the script,
Did you? Even,
I didn't realize
You
it.
didn't realize it.
I didn't realize it. So some of you may know, some of you may not know that my mom's dad, my grandpa, Rudy, he was diagnosed. Well, 1 year ago today.
Yes, it was 1 year ago.
It was Father's Day. We were gonna go
Eat
to
a ham dinner at her house because I was at work excited
yes,
to
my
get off
grandma,
of work.
My grandma was gonna make a big old ham
Yes.
dinner and it was have a
Yeah.
good time, right? And she called and said, "Hey, your grandpa is in so much pain right now.
Yeah.
like he cannot take it." And for him to say he cannot take it, taking it to the hospital, that was some pain.
Yeah, from an old Hispanic
Macho man.
Yeah, yes.
So we took him to the ER here at GRMC.
yes,
And they started doing lab work. They started doing a workup on him. Got his pain under control.
yeah,
And they found some mass. They
Yes.
found some masses in the lymph nodes
yes,
in his abdomen. And so they referred us to the cancer doctor.
yes,
In New Braunfels at Texas Oncology. Right.
yes.
So that started it all.
Yeah, today
Found
is
out-
like the anniversary.
Yeah, we found out today that something was wrong, and later through the oncologist,
Yeah,
through a bunch of PET scans, CT scans, blood
Yeah.
work, diagnosed with stage 4 non-Hodgkin's lymphoma,
And
that
it
was
is- it is
infiltrated
a-
everywhere.
now that we are in the medical field, but being on the other side, just family and being just a family on that side. Yeah, it is. Now we know. Now we can empathize when people go to the ER or are just sick and like, what's taking so long? Why is the test
Yeah.
taking so long? Because you're so anxious to find out
Yeah, and
what's going on.
like people, I don't know if most people understand
Mm-hmm.
that they go to the ER thinking they're gonna have all these answers.
I know.
A lot of times we're just
It's like a Band-Aid to hold you till your
until
on
you
your
can
appointments.
until you can go to that specialist.
Yeah.
And so that's all they did. They controlled his pain,
Yeah.
and then we made an appointment. And if
Yeah.
that's where we found out that he was, cancerous, and
Yeah, because
it was
I
everywhere.
I've always heard that story about when they say that. I've heard it before. I remember this one lady, and it's certain things years ago. This must be over 15 years ago. This lady had, it wasn't pancreatic. It was some form of it for one of her. Anyways, but she said my husband worked his whole life and he laid pipe. He had a company. And I would tell him, let's go retire. Let's go RV, this and this. Well, the day he retired, a couple months later, I don't even think more than 3, she got sick just like my dad. And hers was pretty bad. And I remember her telling me that one day when I was just in there, assessing her and talking with her. And she goes, and now look, we're never going to take those trips. So I was those stories always kind of throw me aback. And so then, but like you hear stories because she got diagnosed at the hospital at the ER too. And so when this happened, I think about her and her family because I'm like, yeah, it was like a movie when the doctor walked in and he said, of course, with HIPAA and stuff, he asked my dad, do you mind me talking freely in front of, and I told him I was a daughter and my mom, and this is his wife. And my dad said, sure. And then when he said, we found something and, you're going to have to go to the oncologist, being also a nurse, not that I'm an oncology nurse, but just knowing stuff, I was devastated. I already put my dad in the grave and said, oh, like, how are we going to maneuver 100%.
This? Like,
because we were all here eating pizza.
Yeah.
And I just said, I'm going to go to the ER. And I was crying. I couldn't stop. I was just crying. I was trying to eat pizza, trying to be strong for the boys. And I said, I just have a feeling it's bad. And I went, and that's when all that happened. And then we were just, I feel for everyone that finds out they get diagnosed, the family, not that, they're coming from someone that their loved one got diagnosed, because it was like a movie. We walked outside. I remember calling people. Me and my mom sat there in shock and just like, what are we going to do?
Yeah.
We don't know what's going to happen. Yeah. And right away, my mom's like, is he going to die? And I was like, it's horrible as a daughter trying to be strong. And because, we're a close family. And I just said, I started thinking like, running with it. I can't imagine my dad dead. Like, what am I going to do? I just ran with it. I didn't know what it all was going to entail our road, our journey.
Of what was going to happen.
Yeah.
And also was sorry because we also had a trip planned to the coast and we went and he was in so much pain, but we kind of put the money down.
I have a picture that I keep out because it was a very expensive. We got a penthouse,
it was a very expensive trip.
We was paid and we thought we were living large. So,
well, it wasn't. I guess it wasn't that important. I mean, we still went.
Yeah, but I have a picture that I keep out. And when my dad sucked it up and he went, he even fell down the stairs.
Dude, like it hurts me so much because like I remember like now we talk about it.
Yeah.
And he's like, you don't understand. Like I was in agony.
He was so sick.
The entire week we were there. And I was
But he sucked it up for us.
Yeah, he did.
And here we are on the golf cart, woo, and swimming and at the beach. And he even fell down the stairs. But so I always keep that picture out because a picture, just to remind myself how in the blink of an eye, seriously, like your world can come crashing down.
Yeah. Like I remember, I didn't really talk about it much. I didn't really, deal with it, I guess, because the family really always kept asking me like, what's going to, I didn't want to say like I was the one, but I was like the middleman for everybody. I kind of explained everything, kind of like walked them through it. And I know you, Dad, Mom, Michelle, we were all there, taking him to the treatments back and forth from San Antonio.
And you were going through school, trying to finish your last leg of it. I mean, it's crazy.
It was a lot going on. And, I don't think I really ever dealt with it. I just kind of, compartmentalized it and just put it in the back of the mind. Mm-hmm. But seeing that diagnosis of the stage 4, like, and coming from the medical field, like, especially how it's infected everywhere.
Yeah.
And they're like, and there's no radiation. They can't cut it out. The only option was chemo. Mm-hmm. And I'm like, like, that's it. Like, there's no way. Like, I already told myself that he's gonna die, and I did. And if Grandpa, if you hear this, I'm sorry, but I thought you were gonna die. I really did.
But you were coming from you weren't, because I think it's a good thing. Like with us, we have we have medical background because we have to say our faith too. We believed and of course, but I wasn't kidding myself. I wasn't gonna say, oh, you know what? Oh, because like my mom, bless her heart, she didn't know. She went to know a lot because he is very good at explaining everything. But there's some things you just, we just couldn't say, he's going to be fine, don't worry about it.
Yeah.
Because
I didn't want to, I didn't want to give the false hope. Yeah. But like I remember one time, like she got a PET scan. And she's like, "Hey, kid, what are these results?"
Yes, dude, because nowadays they put it on the portal. That's what
you can see it.
You can see it, which is a good thing, but a bad thing.
I studied like 2 articles from
reading it
online about this. Wasn't like a Google, "Hey, Dr. Google, what's this?" No, like I actually went to a medical journal. And I'm studying. Yeah. What am I reading? What am I seeing? Just so I can somewhat explain what the medical jargon's saying. Yeah. You know what I mean?
Yeah.
But yeah, and then I just after all that, we went through the chemo six rounds.
Yeah.
6 rounds of what was it? 4
It
or
was
5
like
days?
it was like
5 days.
it was 6 months of chemo. So he
Yes.
did it about every
That was
like twice a week. I mean, every other week.
twice by month.
But yeah,
Yeah, and driving him up there,
and he got
admit him.
sicker and
Yeah,
sicker.
and dude, like chemo is a shit drug.
Yeah.
like people don't understand like
yeah.
what chemo does. For those that don't know, the drug, it attacks every fast replicating cell because
Yeah.
cancer is just a tumor. A tumor is just a cell that keeps dividing that cannot stop.
Yeah.
That's all it is. And it kills everything around it because it takes out the resources. Without going too much into depth about the cancer, but that's the gist of it.
Yeah.
So how do you kill something and how do you target something that looks almost like every other cell?
Yeah.
But the only difference is that it replicates too fast. They made the drug to where it targets fast replicating cells.
Yeah.
So that's why when you see people go through chemo, what do they lose? Their hair. Why?
There's nothing to repeat.
That was Siri. God, was that you? Sorry, my daughter's here. But anyways, like that's when people lose their hair.
Yeah.
Because why? Hair is a cell. It's just a replicating cells in the bottom that's just growing out. So you can cut your hair, it goes back. So people who take chemo lose all their hair.
Yeah.
Because it's going through the cells.
Yeah.
It's a wide. Think of it as dropping a nuke on the person's body.
Yeah.
You're hoping you can kill that cell, those cells, before you kill that patient.
Yeah.
So it's like who's gonna outlast first.
Yeah.
But it was a hell of a ride. It was a hell
Yeah.
of a ride. And like I said, even to this day, I knew it was God. God healed him because he should have died. I told everybody. I told all of y'all he should have died.
Yeah.
But
and those nurses that are the oncology nurses from the doctor's office to the floor that they had there, they were like awesome.
The
and,
best.
Yeah, and
best.
I think what was it the Methodists, right?
the Methodist system, yeah.
And
yeah.
my dad said that him and my mom, they would talk to the nurses and ask them all these questions, and that they had such good training that they would basically tell them. They would tell the nurses part of their training is, look, we know everyone's got problems, but when you come here, you're going to put that aside and you got to focus on the patient because they have cancer. And my dad had said too, because my dad would, he said he'd get up and just walk, hours and with his chemo, and he would meet other people. And I remember him saying one day, and I guess that's just the bond you have when you have cancer. Hey, kind of like, hey, what do you have? What do you have? Blah, blah, blah. And my dad had to talk a lot of them. This is my first time, what to expect. But I remember one time my dad said, yeah, I used to always meet this guy walking. And he goes, and one day he just wasn't there. And he goes, my nurse said he passed. And my dad said, you just don't know what I went through, like just thinking like, but, and I remember telling him too, like it was going to start his third treatment. He was extremely sick. Yes, extremely. It is so hard. And we have friends that we have a friend that their mom is going through it, and I try to thank God help out and explain things and just encourage them. But I remember I went and I told my dad. It's funny. I told my mom, you never see the part when you're home with the sick person. Everyone sees, oh, he looks good. How's Rudy? Oh,
they don't see every single day. They don't see him being sick. They don't see him just not having energy.
They don't see the family's emotions of crying, of calling each other, of just being by yourself in desperation. Like, why, God? Why is this happening? How are we going to do this? You just see you at Walmart. Hey, oh yeah, must be good. You're out, or I see you eating. But so I really empathize when people are going through it, because it's those late night hours when families are by themselves that you just don't know. Thank God for support groups and stuff. But I remember one time I said, Dad, I went over there and I told my brother, I'm going to go talk to him. And my brother's like, you do it. I know, you got the words. And I went and I told him, I said, Dad, I want to tell you, after I was crying, but I bet, because I'm so blunt and I've worked with hospice. And I said, Dad, do you want to go to hospice? Because I remember he was so sick, and he was a big, he was so frail, just leaning against on his recliner. And he goes, I remember he makes these faces. You can probably, huh? I said, hospice. What's hospice? I don't know what he thought it was. I said, Dad, that's because the people who, not just necessarily cancer, but they have
Yeah.
their prognosis isn't good. I said, you could stop your treatment. We'll just give you pain medicines. They'll bring in any equipment.
They
a nurse
they
will come.
make you comfortable.
Yes.
So you can pass.
Yes.
Yes.
And he said, what? And I said, yes. And if you want to stop treatments, don't do it for us. You do it for yourself, because I don't want to be, I just want my dad here. I don't know what you're going through.
Yeah.
And so I remember he said, no. And I remember he he was, and so to this day, we joke about it. Sometimes he'll just look up at me and he'll say, I can't believe you wanted me to die. And I said, you were already dying. I just wanted to help you with pain pills. But
man.
yeah, it is.
But
something.
but it's funny you said bring it up, because I don't think people understand hospice as how we know it.
Yeah.
Because hospice is not a place to where, you're in hospice. All right, that's it. We're done messing with you.
Yeah.
You're just going to die now. No.
Exactly. A lot of people feel like they're not going to get any kind of care.
No,
Yeah.
hospice, I love it because their whole purpose is
Yes.
to make you as pain-free, as comfortable as you
Yes.
can.
Yes.
And to be there and for if you have your family with you, to have those last moments
Yeah.
with them.
And it doesn't mean you're going to die in a month or two.
No.
But
but they
just-
make you comfortable
yeah.
to where you know what? Yes, I'm done fighting, but at this moment, I want to at least be somewhat with my family at home in my own house, comfortable. Because I can't tell you how many times I've seen, patients go into the ICU and they never come out.
Yeah.
Because they're either too sick or they want to try different procedures
Yeah.
to see if they can extend their life just a little bit longer. But and when it comes to cancer,
yeah.
it's one of those things like, do you want to keep fighting and feeling the way you're feeling, or do you want to make the best out of these moments? Because once you stop that chemo, a lot of the side effects do wear
Yeah.
off, and
Yeah.
then you can somewhat have
Yeah.
a normal rest of your couple of months.
Yeah.
You
Like
have-
that kind of feel better if
exactly.
you go on a trip or
Exactly. Yeah.
go see
And
somebody.
so,
Yeah.
like I've told them 100% my family. I've told here in the podcast before that
Mm-hmm.
I do not want to be kept alive by machines.
Yeah.
Like, let me pass peacefully. Let me go be around my family. That's all I want. Because, I've seen the other side where, man, like you see people just
Kind of linger.
struggle.
And
at
a
the
lot
end
of
time.
times I think not all of them, because a lot of times, they do it for their families,
Yeah.
you know?
And what's always interesting? You see those that, they come and they tell their family, like, hey, like, it's okay.
Yeah.
Like, you can go.
Yeah.
And I know you've seen it.
Yeah.
Probably. You've seen
You
those
tell
when
'em.
the family says, hey, like, it sounds weird, but like, give them permission that it's okay that
Yeah.
they can go.
Yeah.
And then they pass. But
Yeah. And one thing like about just with our family, like I said, we have a faith in God. We have seen a lot. This year, we have seen a lot of miracles, from financial for them, doctor's appointments, different people coming in their lives. But I believe too, spiritually, you gotta believe in something, because it's, it's, and I know, and I personally always told myself, like, if my parents pass, like if someone passes away, I personally never say any of the cliche things. Oh, I'm sorry. Like, they're not in pain. I never say that. I just give them a hug and that's it. Because I personally don't want no one telling me your dad's an angel. God needed him. No, God did not need him to be an angel.
Yeah.
It was better. Okay, I know that. But I don't want to know. I don't want all that.
I just want you to be in that moment with me.
Yeah, just be there. Just
Shut up.
Yeah.
Just shut up.
don't be telling me, hey, you'll see him again. I know I'll see him again. Okay, I better change my ways so I can go to heaven one day. But anyway, so yeah, so.
Grandma's gonna call you after she sees us. Yeah, like, hey, we gotta pray. Let's go.
But yeah, it is. It was a crazy time for us.
It was a ride.
And you just never know, right? You never know.
You gotta
what's
live.
next.
You gotta live one day at a time.
Yep.
Because you never know when the big Lord's gonna call your number.
Yep.
That's it.
That's what they say.
Oh man. So enough of that.
Enough of the sadness.
Got some stuff out. I haven't talked about that stuff in a long time.
I know.
I don't think I ever talked about that.
As a matter of fact, Grandma's the one that told me, it's been a year. And I was like, oh, how did I forget? And then I
Yeah.
told her, are we still gonna have that ham dinner? And she said she will. Can we make up and get that ham dinner?
Well, we gotta go back to the coast and take him back to where he's not.
That he's not in pain.
Yeah, he's like, oh, because he told me, he's like, I want to go back because I want to actually enjoy that penthouse we got. And I'm like, we will.
Yeah, yeah, we will. Oh my God, that was
man,
crazy times.
That was a sorry, Grandpa, but
Yeah.
that penthouse was nice. I wasn't gonna let that go. 76-year-old man was held and has a cash bail of $100,000 after he stabbed a nurse at Haywood Hospital in Gardner. It happened Monday at 8 p.m. in the hospital's emergency room.
Oh my
Mr.
God.
David Nicholas was arrested at the hospital and was charged with attempted murder and assault and battery with a dangerous weapon. He stabbed her with a 4-inch knife, stabbed her in the neck with his pocket knife
I think you know what?
while he was getting hooked up to oxygen tubes. The defendant grabbed her by the neck with his left arm and then she said she felt a laceration to her neck and immediately screamed for help. Everybody rushed in. You know, he was 76 years old, so they were able to, subdue
Yeah,
him.
yeah.
But yeah, she got stabbed in the, she's alive. She's alive.
Thank
She's
God
alive.
it
But
didn't hit her artery.
hey, well, you know what? At least she was in the hospital. So I mean, kind of the best place to have
That
it. You ever heard like if you have a heart attack, at least you're in the hospital. Like this is the best place to have one.
Right? Something's gonna happen. Yeah.
Yeah.
That
No, she's good, but yeah, they stabbed her in the neck.
that is
neck,
crazy.
bro.
But I thought I had read. Was it true that he has had assault before? Like he did something like this before.
He
right?
has a 6-page criminal record,
That's right.
including past assaults, and
yeah. And I can
but
attest that when I see some, like we have some older, like 80s in their 80s, older people in our jail.
Oh, sorry. Listen to this. He says so. He is dying of lung cancer, and so I guess he was given approximately 6 months to live, and I guess he just said,
He just,
"F it, I'm done," and just went bah. But
oh
yeah,
man,
that is. Oh, can you imagine? Be
And
like, can you imagine? Because I mean, you get close to your patient. I know I do when I'm trying to put the
Yeah.
oxygen on them, and you're trying to loop the nasal cannula around the ear. You're like, come here. And I'm like,
But you do, even when you have to lean across to grab something, you're next to them.
or you're right there taking the IV out of their arm,
Yeah.
and they're just sitting you, and this is the same one that's hearing voices, and I'm like, this. I'm like, please don't hit me, bro. Please don't not clock me right now.
Yeah, you
But,
have to
yeah.
always be cautious because you don't know who's crazy. Yeah,
dude,
that's cray.
that's well, like I said, so watch your necks out there. Buy a neck guard.
That's why we can't be wearing no jewelry at jail. I ain't gonna have no one grab. What? And even though I wear this, I just want to grab me and choke me and drag me into the cell. We're gonna go down with the fight.
Man, you'll be biting. They're like, man, why is there a human ear in your mouth? Like Mike Tyson.
I'm like, try it. I take your ear, nose off. I'll bite something off.
you know, I don't know what I told you. Like, you know how easy it is to bite through your finger?
Yeah, because it's like a carrot.
It's like a carrot.
I
Yeah,
think about that.
Like, not like, I mean, think about it. You can go get a chicken wing and just bite
Yeah.
the bone. And like, you can crack it. That's just imagine your finger, right? But like right there in the joint, it's about the same pressure as biting the carrot. That's just imagine that. So next time you eat a carrot,
I know.
go.
And I
be
love
like-
baby carrots. And now that when I dip it, and the day I bit one, I thought about when Noah says, I'm like, I know that's crazy. But hey, all right.
There we go. There we go. So I want to leave us with one quote before we end this off. So it is by Gandhi. The best way to find yourself is to lose yourself in the service of others. I think that's
That's
good
a good
for,
one.
I think that's good for us nurses out there. Like I said, if you came in the profession for probably one of the many things to care for people, right?
Yes. Yes.
Just lose yourself in that service of others. But what?
And just real quick, so my granddaughter's sitting in this chair over here on her iPad. And so as we're talking about the carrot and the biting, and she looks at me, she's like, what? She's going, what? So she distracted me because her face is like, what? Okay, we don't need to be talking about your family
so
secrets.
Don't
with
worry about the
hamsters.
hamster, not the hamster. All right, guys. Well, that's all we got for right now. You have a great one.
Yeah,
Catch
have
us
a
on
great
Facebook,
one.
catch us on YouTube, and share and like and subscribe. See ya.
Bye bye.